Hello, friends. A very good evening. I'm Dr. Puja Kapoor, consultant pediatric neurologist, Paras Hospital, Gurgaon, director and co founder, Continua Kids. So, the topic of today's discussion is the most commonest treatable causes for global developmental delay. So, before we go into the causes, let us first define what is global developmental delay. So, as the name suggests, that it has to be global and there has to be a delay. So, now moving to the next thing, what we call as delay. So, we define the human developmental milestones into four domains. The first is motor component. Motor is divided again into two parts, fine motor and gross motor. So by gross motor, I means head holding, sitting, and then walking, and then running. So a child develops this milestone by the age of 4 to 5 months. Myelination happens till for the control of the neck, and the neck starts become steady. After again 4 to 5 months, by the age of 8 to 9 months, the child starts sitting without support. So by the age of 6 months, the child would sit with support. With some support, the child would sit, maybe the support of her hands, something. Then by the age of 7 months, without support, sitting would come. But as soon as he would turn the head towards one side, he may fall. By the age of approximately 8 months, sitting without support, and if he will turn this side or towards this side, he won't fall. And by the age of 9 months, even if you give something, he would reach out also, and still he is very stably sitting. So, this is the sitting without support milestone. Then, by the age of 11 months, would stand with support. By the age of 12 months, walk with support. And then, as another 1 month, he would walk without support. So these are the motor milestones which happen. So this is one component. The other component is fine motor. Fine motor, what do you mean by fine motor? As soon as the child reaches approximately 3 months, 4 months, mouthing comes in. So he will take his thumb and towards his mouth and will start suckling. So this is like hand mouth coordination will come. And another next 15-20 days, they would be reach for the object. If you will just hang around something in front of the baby, so the child would try to reach, and the reach would be like this. So this is called as palmer reach. He won't have that finer things to grasp. He will grasp everything like this. So that is what you call as palmer grasp or reach by the age of 4 to 5 months. And this is a fine motor thing. Next comes the pincer grabs. If you will have very small things, so by the age of 8 to 9 months, he will try to pick up the finer things. So that is what you call as pincer grab. That's a component of fine motor. And then he would know to transfer one thing to another, from this hand to this hand, and so on, so forth. That's called as transfer of object. That also is a component for fine motor. So this is one component of motor component, both inclusive of gross motor and fine motor, and that's one of the domain for development. Next come another domain, the next one, that is called as speech and language. So by the age of approximately 18 months, the child would have, or even before that, let's go to by the age of 11 months, the child would start having some vowels. Mama, ma, da, ba, pa. And as we cross a year or so, that would become some joining of the words. That means joining of two vowels. Baba, dada, mama, papa. And what we expect by 1.5 year or 18 months is that he should be able to at least speak 5 contextually viable words. Contextually means mummy ko mummy, papa ko papa, dada ko dada, papa ko baba, this. Okay. So this is one of my speech and language milestone. And as the child grows, these words, the vocabulary grows, and then joining of words comes in, and so on and so forth. So that's the another domain. The third domain is social and communication domain. That means by the age of approximately 10 months or so, if I'll say bye bye, so he'll try to do bye bye. He will have a very good eye connectivity with the person concerned. He will respond to his name very well. So that means I am social and I am communicating, even though non-verbal, but still by the gestures, I am communicating. So if you will say high five, he'll do high five. You will say bye bye, he'll do bye bye. You will say okay, dekho there. So point towards object, he will do that. Joint attention. If I'll tell him okay, udhar dekho, so he'll look towards that and then acknowledge that he has seen that object. So this is social and communication. The next is cognition. Cognition means that he should be able to have abstract thinking. That means if I'll tell him, okay, do this, and so he will find out other ways to do that thing. If I'll tell him, okay, we will place five blocks, and if I'll place the sixth one, this will fall. So he has that. Okay, I'll not put the sixth one. So, that abstract thinking, the cognition part, what to say, what, why, all these things starts coming in, and that is what you call as the fourth component or the cognition part of it. Now, what is global developmental delay? If you have delays in more than one or more than two components, that we call as global developmental delay. So suppose you have a delay in motor, we will just say motor delay hai. Baki all the components are good, then we will say only motor delay. So global is once you have delays in two or more than two components or more than two domains, which I have told. Okay. So why do we need to categorize this? Because the reasons are very different. If I'll just have motor component delay, that means I'm not holding the head, I'm not walking, I'm not sitting, but my cognition is good. I'm responding, I'm listening, I am interacting, I'm pointing, but I have a motor delay. Then the reasons would be different of motor delay, and I will look into different reasons as compared to what are the reasons for global developmental delay. So if I have component deficiencies in two or more than two, I'll think of the reasons of global developmental delay. So the every milestone has got a range. So if those milestones goes beyond that, they are not achieved beyond a certain age, then what we called as, then what we label as there is a delay. And we should know there are certain guidelines, there are certain papers on where what is the component and till what age it has to be achieved to be rather called as a red flag. So, like for walking, we say some children start walking by 9 months and some children start walking by 18 months. But 18 months is the time when I have to walk independently without support in a good posture, and I should have a good gait while walking. So, beyond 18 months, that's a red flag if the child is not walking. Similarly, for each and every component, each and every milestone, there's a red flag. And because there's a range, some children start doing that early, but there are certain things which they should do by a certain age. If they are not doing that, that is the red flag for that milestone. Now, coming to the topic of today, what are the treatable causes? You can divide global developmental delay into various categories. The first most common categorization is the delay which could be treatable and the delays which could be non-treatable. So we are going to talk about delays which are treatable. So the most commonest one is like hypothyroidism. So what will happen to a child who has got hypothyroidism? So a child would be born normal, but later on, as the child grows, the child would become very puffy, very obese. He'll gain weight like anything. He'll have edematous body. That edematous means puffy body. Everything would be like swollen sort of thing. And all the component would be delayed. So by the age of 4 months, the child would not be able to control the neck. He would be very slow in the cognition. If you will just clap, he will turn towards the side, but in a very slow posture. He will take in the milk, but in very slow way. So basically, all in all, he would be a slow child. And some parents ask that we would do that thyroid testing at birth. Yes, that is what you call as congenital hypothyroidism. And if not treated on time, or if not diagnosed on time, suppose I diagnosed hypothyroidism by the age of 8 months, that's too late. Because thyroid hormone is the hormone which starts acting on the brain and sharpens the brain, helps in the cognition part of it, helps in the metabolism part of it. And if it's delayed, if the hormone is not present for the first 8 months, or whatever the developmental age of the child, you can have dire consequences later on, that the child may not function, and later on he may have lower IQ or intelligence quotient as compared to the peer age group. So we have children coming to a therapy center who will diagnose very late. The thyroid hormone deficiency was diagnosed very late, and so they are like there's a lag between them, between the cognition part of it, and so they are taking special education and other things for the as a therapeutic intervention. So the take home messages, and that is why in all the hospitals now it's basically compulsory to do thyroid testing at birth. So because we want to know the thyroid status at birth, because if it is low, if it is TSH is high, if the thyroid is low, hormone level is low, then we have to treat it with outside supplementation by the thyroid hormone, so that my cognition later on is not affected. So later on, as the child grows, maybe he may not be having so much puffiness, but you will find out that in all the domains he's slow. He's responding to his name, but it's a very slow pace. There's a latency period between his reaction time and the command which is given. He may pick up the command, but not at a pace at which he's required to pick up, or his peer age group who's normal are picking up. Okay, so you should suspect hypothyroidism if I've got a slow reaction, if I am a bit puffy, my skin is a bit dry, I've got constipation. So constipation, because the peristaltic movement also is not that great, and because of that they have a lot of constipation. They will eat, but they will have a lot and a lot of constipation. Okay, so that are all the major points which you have for congenital hypothyroidism, which may lead to global developmental delay later on. Okay, second, that's called as ITS, or infantile tremor syndrome. So what happens in a lot of I'm at Gurgaon, and a lot I see a lot of children from Haryana, and what we feed in the initial stage or till the age of 1 year or 2 years is just milk, and that milk also is like mixed with some water. That's a buffalo milk and mixed with water. Or they are doing just breastfeeding, but the mother is not taking so great. The nutritional status of the mother is also not good, and as soon as the weaning start, that means by the age of 6 months, when you are asked for to supplement or to complement, to start giving complementary diet in the form of suji ka halwa, or any other food in the form of khichdi or some fruit, they don't give, and they just feed only on mother's feed and only on cows or buffalo milk, which also that too is diluted. So at that point of time, there is a very high chance that because of the dietary problem, the child may have deficiency of vitamin B12. And if that vitamin B12 deficiency lasts for a longer period of time, there is a lot of regression of milestone, and the later may child not be able to pick up and become normal as compared to the peer age group. So, and associated with the deficiency of vitamin B12, because of the dietary concerns, you may have regression of milestones. So that means a child may be holding the neck, the child may be having a social smile, the child may be pointing towards object, but if there is a long lasting deficiency of vitamin B12, because vitamin B12 is a vitamin which is required in the formation, or it is there in the formation of the neuronal sheath or the nerve. And so because of the deficiency, the nerve sheaths are not formed well, the neurons are not greatly connected, and because of that you start regressing in your milestones. And the child may have small tremors like this, only this much. So that is why it's called as infantile. Infantile means present in 1 year, first year of life. Tremor means because of the deficiency of vitamin B12, they have just fine like movement, the tremors. And this is a syndrome because there are multiple other factors. There is a regression. There is, the knuckles become very darkened up. The knuckles which are white, which were previously white, they may darken up because of the deficiency of vitamin B12. And if long lasted this deficiency is held, the child may never be able to overcome that, and they may have neurodeficits later in life, even though after that you supplement them with large doses of vitamin B12, still there could be a deficiency. So those are the treatable cause of global developmental delay, and we see a lot in Haryana because of the faulty feeding, faulty diet, deficiency of vitamin B12 in mother's milk also, because the mother is, vitamin B12 is mostly found in green leafy vegetables and a lot of non-veg. And because a lot of part of our population is vegetarian, so they have to depend a lot of other legumes, leafy vegetables, and they have to consume a good chunk of that to complete or to fulfill the deficiency of vitamin B12. Okay, so that's the second cause, which is a treatable cause for global developmental delay. The third is vision and hearing concern. So that means there's a lot of children who have got a hearing concern, but because they are not hearing, they would not be able to speak and they would not be able to understand. So they may have a very good eye contact, but then because they are not connected with the world, because they are not listening, they don't understand anything, so there's no speech. Also there would not be any understanding, and because there's no understanding, sometimes they resemble the features of autism spectrum disorder. They will start playing with themselves because they are not interested in the surrounding, because the surroundings are not interested in them. They are not able to get the environment stimulus, and so they may have the features which are very much similar to autism spectrum disorder. But as soon as we start they start hearing, they start understanding, and once you give them a lot of speech therapy, they will start speaking. So that is also one of the treatable cause of global developmental delay. So in this, motor development would be absolutely normal, it will not be affected, but other components like cognition, like speech, like vocabulary not connected to the environment would be there. Okay, similar case is with the vision also. So we have children who were like engrossed with themselves, they were not attentive to the world because they were not having a good fixation. They were not able to see the world as we are able to see. If I remove my glasses, I would not be able to attend, or I will not be able to connect it to the world, because there's so much of, everything is so hazy. So maybe I'll walk very slowly to see whether I should not fall. I will not connect to the person concerned who is sitting very far off, because I'm not able to read the expression of the person concerned. So I would like to be into my own word. So please get your child tested for vision if you have any concerns of vision. So the child is not you squeezing the eyes and then visualizing, or is holding the pen very nearby or the paper nearby to read. And sometimes, the child don't tell you, because he thinks that the word is like that, the word is hazy, and this is how the word it is. So always get the eyes tested, no matter if you have any symptoms or not, because we have seen the children accommodate themselves and they will not come to you for any complaint. And we found out that they were refractory error, or there was power of 4 or 5. So always test your child vision if you have any concerns. And even if you don't have any concerns, just get it tested. By the age of 3 years or 4 years, it has to be tested. Okay, so now next come the other cause, that is called as infantile spasm. So what is infantile spasm? So infantile is a child who is less than a year old, and spasms are, these are small jerks like this. That's it. So once the child is going to sleep, or once the child is coming out of sleep, that means in a drowsy state, the child would just have these jerks. That's it. these jerks. That's it. These are called as spasms. And many a times we have seen the parents miss it, that they think of these are just the child is chonk raha hai, the child dar raha hai, and they will just wrap the child and put it in one corner so that the child does not do this. But this will happen. So, especially in children who have got any history of any NICU admissions, preterm deliveries, or who have did not cry immediately after birth, requires observation in an NICU, did not or had small seizure or some minor problem, hypoglycemia, that means lessening of sugar at birth. So those are the children who have a very high propensity of developing these jerks or infantile spasms. They start by the age of approximately 4 to 5 months of age, and then they can appear by the age of 8 months or 9 months, but definitely less than an year old. And these are mistakenly not treated, and once you don't treat them, the child, whatever milestone they have achieved, they will start regressing. So suppose by the age of 5 months the child has just started smiling, and these jerk starts, you will see that the smiling has stopped in another next 1 or 2 months. The child may be having a eye connectivity, it has just started, and then you see these jerks, and then you will see that the eye connectivity is losing. The child may be very apathetic, that means he will just lie down listless like that, would not try to move. Slowly the child who was good in movement, who was very, the cry tone activity was good, slowly you will see within a period of another, once the jerk starts happening in a period of 1 to 2 months, the child will just start losing interest in the surrounding. And for this we have to do an EEG at the most earliest, so that if these are there, we treat the thing, because if they are not treated, again they will give rise to global developmental delay. If they are missed on and they are treated very late, then also they would have like a global developmental delay type of picture. The children won't be able to cope up with the peer age group. Okay, so these are the treatable cause. The other one is vaccine preventable causes. So two major important the causes are, one is SSPE, that means subsclerosing pan encephalitis. So that means the child who has not been vaccinated for measles, or the child who has not been vaccinated, but before he get vaccinated at the age of 9 months the first shot of measles comes in, the child had measles like illness before, later on in life, at the age of 4 years, 5 years, 10 years, 12 years, or maybe later on, the child slowly may have regression of the milestones, and the child who was walking, talking, speaking, was doing everything, slowly over the period of 2 to 3 months, the child would start declining. That means the child who was walking would start showing symptoms of, he will stop talking. His words, vocabulary would decrease. His thought process will get deviated. If you'll ask him, okay, go and keep this book over there, he will just get confused. He may start falling. The child who was running beautifully well would start falling, because there are small jerks. As I told you, in this also, SSP also, there are small jerks. And because of that, the child who was walking would start falling. And over a period of next maybe 6 months or a year or so, the child would be bedridden. So that means this happens because of the measles virus, which when gets into the brain slowly multiplies and cause panencephalitis. Pan means the total, encephalon means brain, and itis means inflammation. So slowly the inflammation of the brain starts happening, and the child will lose all the milestones because of the measles virus, which goes and multiplies in the brain. So that's a very important preventable cause, vaccine preventable cause for uh, SSP and or what you call as regression of milestone. So please kindly vaccinate your children for measles vaccine, because the the enigma which is associated with measles vaccine, that it may cause autism, that has not been proven ever again after Wakefield gave this theory. But we are seeing, and we are very sorry to see these children who have not been vaccinated by measles vaccine to have SSP. So we see a lot of children from Uttar Pradesh, from rural background, because they are not aware of the vaccines and they are not giving vaccines, and they come up with a lot of SSPs. Okay, so all the adjoining areas where I practice, from MP, from UP, from Haryana, from Punjab, from all these states where the rural background, they come a lot, because the children have been given the history of not being vaccinated with measles, and slowly they develop this SSP, and then this is like we are not going to get the child back ever. Okay, there's no treatment as such till now. The other vaccine preventable cause is rubella. So, in that, if the mother has rubella during the pregnancy, the mother may just present with the symptoms of just cough, cold, fever, but the child may have a plethora of symptoms. He may present with global developmental delay. So, we have a few of our children who are coming who have got rubella syndrome, and because of that, they are global developmental delay, because the mother was not vaccinated for rubella. So, rubella again is a vaccine preventable disease, which the mother may not have a lot of symptoms. But if rubella virus, the mother has rubella infection during the pregnancy, the child may have global developmental delay. And again, that's a very much preventable cause for the global developmental delay in the child. So please, all those treatable causes which I have told you, please make sure that the child have all these checked up. If my child has a feature for developmental delay, please, you have to get them checked. There are lots of apps which are there which can check your milestone. So like as you're feeding your child, just try to get a you know get the milestone checklist also. So at Continua we have developed an app, and you can just download an app and you can just put in your milestones in whatever your age of the child is, and you can put in the milestones. They have you have to answer yes or no, and if the child milestones are age appropriate, you they will give you, wow, your child is absolutely clean. And if you have the red flags, they will alert you. Okay, so in this domain the child is having red flags, please reach out and find out whether they are really, go and do the screening and then get the causes ruled out whatsoever they are, because it has been proven very well that if you intervene early, the child will have a very good outcome. And later intervention is like you may not get the child back as it was at the baseline. So and also you can check it like every 6 monthly. Just make sure, just mark it on your calendar. Okay, I check the milestones at 4 months, then again after 6 months I'm going to check the milestone, and that's like a 5 minutes job. So you can download this app and get it checked, please, so that no child whosoever wants to have to go to the highest potential reaches that potential. Okay, and if there are treatable causes, the child could be treated as soon as possible. Okay, so we'll go to the questions and see. Okay, so now I'm getting all the questions for autism. Hmm. So, so Deepak, I'm not going to answer this question because right now this topic is global developmental delay, huh? So let me just find out कि अगर जो है, there are any questions which are related to uh, global developmental delay. I will answer your questions, but not in this, because then the topic is totally off. No. So all the questions are related to just autism. So we will have the autism questionnaire round only one day. Maybe we will have just questions, and then we will see and answer all those. So any question related to uh, this, I will treat. I will answer for global developmental delay. Yeah, I could see. So there is a one question which is like, "Hi, madam, how to treat vitamin B12 deficiency?" Okay, so if the vitamin B12 is there, so you what we give it like we should how what more should we check? Okay, so first of all, you can check the vitamin B12. It's just a plain simple blood test, vitamin B12 level in the blood. So if there is deficiency, then what you have to do is like we give injections for few days to just replenish it fully. And after giving injections, injectable intramuscular vitamin B12 injection, and then we give oral through the mouth vitamin B12. So there are few syrups which are very high on vitamin B12 like Nerves. So there's a lot of vitamin B12 syrups which are available, but I want to give it in a very high dose, which is like 1000 micrograms. So there's a syrup called as Nerves. There are other syrups also, the journally which I prescribe. So it has a very high quantity of vitamin B12, and so that I prescribe, so that even though the child is not eating, if the child is not supplemented, at least the child is given this, so that the stores are fulfilled. And in the initial stages, for for the first month and all, I give injectables, so that I'm sure that I am given vitamin B12 inside intramuscularly, and then followed by orally. Also, I would make sure that the child start eating even a egg one day, or anything which things which are rich in vitamin B12, because I don't expect children to eat green leafy vegetables like this, but at least if some quality of green leafy vegetables are introduced, you should try to increase that, and give vitamin B12 rich diet. Okay, because I'm not going to supplement the child for years together. Okay. Oh, okay. Any other? So, is there any Veena Yuvraj? So, Yuvraj is asking for, is there any medication for global developmental delay? No. Global developmental delay is not a diagnosis. Global developmental is a term. What is the cause? So, what caused this global developmental delay? Because the global developmental delay could be because of hypothyroidism, could be because of vitamin B12 deficiency, could be because of so many other reasons, could be because of genetics reasons, could be because of metabolic reasons, could be because of mitochondrial reasons, could be because it is inherited like genetic. So those could be 100,000 reasons are there. So it's not one thing that is, as if I diagnose it as global developmental delay, I'll put forward what is the cause, and accordingly the treatment comes into play. Okay. Okay. So Anjali, yeah, there's a question by Anjali Kadam. मेरा बेटा 15 months का है पर sit और stand नहीं करता है. Okay, Anjali, so no, we have to do something about it, because 15-month पे sitting is a delay thing. And this is only motor delay, or you have other problems also? Other problems means that, what about his 15 months? Pointing, eye contact, response to name, bye bye, cognition, building up of the blocks. So what is happening of other milestones also? I need to know about it. Okay. So you have to really go to a doctor, because 15 months not sitting, not standing is not a good milestone. Not, we are late. Okay. And so, yeah. So there's another one, Ruane Villaflor. Hi, madam. My daughter is 7 years and has global developmental delay and non-verbal at her age. Keep on babbling but say mama. Is she ready for speech therapy? So, if the child has good eye contact, command following, then definitely is sitting for a longer period of time, then the child is good for speech therapy. So If my child has global development delay but is started sitting, sitting means giving attention. If I am just running all over, because a lot of global developmental delay could also have features of hyperactivity. So if my daughter is just sitting, started sitting at one place, if I'm following the command, if my RAIM response has come in, then that is the time you should go in for the speech therapy. Okay. 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 So, Vandana. Hi, ma'am. I consult with nutritionist for my ASD kid. She suggested to give vitamin D3 gummies and calcium magnesium. I mean, I don't know why for ASD, autism spectrum, I'm giving all this. I have to know. Because if the child has deficiencies, then definitely you can give. I don't know why you're giving. If you are maybe giving some GFCF diet in which casein free diet is given, so maybe calcium supplementation is there. But it's not good to give for every child, even though if this not deficient. I should know the reason. Okay. Okay. I mean, any other question for so Ashish, I have shown you 29 December, Shivansh. But what is the question? I don't know the question. Um, yeah. Anupama Lalwani, that's a good question. Can meningitis in early age affect child development? Yes. So meningitis in early age can affect the development throughout life. So if meningitis means what? So our brain is covered with a lot of meninges, three meninges. That means the covering. And if there happens some inflammation in that, that means meningitis that can give at that point of time. If it happens in a very early stage, in the development stage of the child may have repercussions of that. If the meningitis is so bad that it has affected the brain also, later on you can present just as global developmental delay, because the bacterial or viral infection has caused damage to the brain, and that damage is permanent damage, and that is why the child could have developmental delay. Yes, meningitis is one of the cause for global developmental delay. Okay, so I think that's the last one. Is gluten-free diet good for the child? I mean, I don't know. If my child has celiac disease, then definitely I'm going to give my child gluten-free diet. If my child does not have celiac disease means allergy to gluten, and the child is unable to digest gluten at all. But if my child has no such problem, then gluten has to be given. So there's a lot of thing about gluten and development and gluten and autism spectrum, but still not proven. If my child has certain GI symptoms in the form of bloating, in the form of vomiting, in the form of constipation, in the form of nausea, in the form of increased frequency of motion, then I could think of that. Okay, and along with that, my child has autism spectrum disorder, then I could think of chalo, let's see and remove gluten. But apart from that, there are no indication of removing gluten in the diet. Please. Rest is, there's a lot of commercial things which are happening and not yet proven. Okay. So I think that's it for today. Sorry for that. So I think there's one more question. My 2.5-year-old daughter is diagnosed with global developmental delay and is hyperactive. She doesn't allow therapists to do therapy. What medicine can I give her to calm her down? No, no, no. This is not that way. So no medication has to be given on social media. Okay, we have to assess the child first. How much is the hyperactivity? Is there any cause for the sensory concern because of that hyperactivity is there? Or my child just has hyperactivity? you know if both, because the treatment for both of them are totally different. If I've got a lot of sensory concerns and because of that I'm hyper and not able to touch the child, that is a different reason and the treatment protocol is different. Whereas a child who has got just hyperactivity, the treatment protocol is totally different. Generally, we don't start the child who's just 2.5 years for a lot of hyperactivity medication. First, we see the child and do a lot of other therapies rather than just starting her for medication. So, no, I'm not going to give medication on a social media. You have to go to the doctor concerned, find out the cause, tackle that, and obviously, if it is not tackled and if it's just hyperactivity, just is not able, we are not able to tackle, then definitely we're going to give some medications. Okay. So I think I've answered up everything. Thank you very much for patient hearing. And I know there are a lot of questions which I have not answered, but all those were a lot of from things to do with autism. So one day we'll just take up all the questions and nothing else. Okay. And that time we'll just tell you in advance that this will be a questionnaire duration and we'll answer up all the questions related to ASD. So, right now, thank you, friends. Thank you so much for patient hearing and just do everything, whatever you can do for your children. We are getting a lot of queries and we are happy to answer them. Try to help them. Help your child, help your children, understand your children, learn as much as you can, and just apply them on your children so that you can get your children the best out of them. Thank you so much. Have a good night. Bye.